So we know that biceps does flexion. So similarly, we need to remember that biceps does flexion. Who does flexion in knee? Hamstrings. Who does extension? Quadriceps. So there is rectus femoris, which will be in front because it is part of your quadriceps and it is an extensor. Biceps has to be part of your hamstrings because it does flexion. So you can remember biceps and biceps. Both does flexion. Biceps does flexion of elbow and biceps femoris. Femoris is femur bone that does flexion of your knee joint. So it is part of your, so never confuse rectus and biceps. Biceps will come behind, rectus will come in front. Okay? You need to remember that pes inserine. How will you remember? See, there is no muscle on your lateral side, correct? When there is no muscle, you have muscles in anterior group, medial group and posterior group. You have 3 groups only. You don't have any muscle in lateral side. It is only tensor fasciae latae and iliotibial tract. So there is one muscle which is coming from anterior group, one muscle which is coming from medial group and one muscle which is coming from your posterior group. All 3 are getting attached here in the form of E, which is called as pes inserine. So these 3 muscles are front sartorius, medial gracilis and from back it is semitendinosus. Because semitendinosus is coming from the center, so that will join so that it can cover your medial posterior aspect. So it is like a gay wire which is looking after your hip and knee all together. Okay. Now in leg we have 3 groups: anterior, lateral and medial. That's all. Medial and posterior is same. Okay. So we have only 3 groups: anterior, posterior and lateral. Now medial is covered in your posterior only. So anything which is attached anteriorly is attached posteriorly. Just remember this. Now you have peroneal group of muscles laterally. So laterally you just have 2 muscles: peroneus tertius and longus. Peroneus brevis and longus. Brevis is small, longus is long. Okay. So you have only this. Now anteriorly you have this bone is tibia. So you have tibialis anterior. Because this bone is tibia, posteriorly you will have tibialis posterior. Anteriorly it is tibialis anterior, posteriorly it is tibialis posterior. Now anterior group does extension, posterior group does flexion. So whatever muscle next is all named after the action. That is, this is called as hallucis. These are digitorums, digits. So muscle's name is tibialis anterior and next comes extensor hallucis longus. So it extends your big toe, extensor hallucis longus. Then comes for digits extensor digitorum longus. So similarly you have posteriorly tibialis posterior, flexor hallucis longus, flexor digitorum longus. Okay, it is same. So it is so easy to remember. Correct? Dick and Harry. We call it as Tom, Dick and Harry. Tom is tibialis anterior or posterior. Dick is digitorum and Harry is hallucis. Okay. So it is easy to remember. Tibialis anterior, extensor hallucis longus, extensor digitorum longus. Similarly, tibialis posterior, flexor digitorum longus and flexor hallucis longus, and laterally you have peroneus longus and brevis. There is one more muscle, peroneus tertius, which is part of your extensor group that merges. So you have extensor digitorum longus and extensor digitorum brevis also, which is a small muscle. Brevis is small, longus is long. Done.
हो जाएगा थोड़ा